Hello, everyone. Thank you for joining us for this month's webinar. The topic is women's heart health, and our presenter is Robin Glock. She's an RN and health coach with Orthus Health. Robin?
Hi, thank you for joining in for this month's webinar, which is, like Dawn said, Women's Heart Health. And we're going to talk a little bit about what you need to know about heart health. Heart disease is the leading cause of death for women in the United States. Cardiovascular diseases and stroke kill approximately one woman every 80 seconds. Women have a higher lifetime risk of stroke than men, and fewer women than men survive their first heart attack. So when you look at the statistics, it's a little bit eye-opening. I think a lot of people don't associate women and heart disease. It seems to be something that they look at as more of a man's disease. So it's something that should be taken seriously and is important information to know. February is American Heart Month, so we go red in February. To make women more aware of the danger of heart disease, the National Heart, Lung, and Blood Institute sponsors a national program called The Heart Truth, in partnership with many national and community organizations. The program's goal is to raise awareness about heart disease and its risk factors among women and educate and motivate them to take action to prevent the disease and control its risk factors. The centerpiece of the Heart Truth is the red dress. It was introduced as the national symbol for women and heart disease awareness in 2002. It has also been adopted by the American Heart Association to create synergy amongst all organizations that are committed to this cause. The red dress reminds women of the need to protect their heart health and inspires them to take action to lower their risk for the disease. In 2004, the American Heart Association had faced a challenge. Cardiovascular disease had claimed the lives of nearly 500,000 American women, yet women were not paying attention. A lot even dismissed it as an older man's disease. So to dispel the myth and raise awareness about heart disease and stroke as the #1 killer of women, the American Heart Association created the Go Red for Women, which is a passionate and emotional movement designed to empower women to take charge of their heart health. So a woman who goes red follows an exercise routine, keeping active, making exercise a priority in their weekly activity. A woman who goes red eats a healthier diet, focuses on less processed food and refined sugars. A woman who goes red visits her doctor for important tests, having a physical, knowing what your blood pressure number is, your cholesterol, your blood sugar. A woman who goes red influences others by talking about heart health. National Wear Red Day is a day of action to show support for women in heart disease awareness and promote that red dress symbol. On the first Friday in February each year, women and men across the country unite in a national movement to give women a personal and urgent wake-up call about their risk for the disease. It was celebrated on February 2nd this year. Everyone can participate by showing off a favorite red dress, shirt, tie, jacket, hat, whatever your interests are, or you can just wear the red dress pin, which you can purchase on the American Heart Association's website under shopheart.org. So what is heart disease? Cardiovascular disease, also called heart disease, can include a number of different heart problems, but many are related to a process called atherosclerosis. This is a condition that develops when plaque builds up in the walls of the arteries. The buildup narrows the arteries, does make it harder for the blood to flow through. And if a blood clot forms, it can actually stop that blood flow. And that disruption in blood flow can cause a heart attack or a stroke. Risk factors are conditions or habits that make a person more likely to develop a disease or see an existing disease get worse. some important risk factors for heart disease that you should be aware of is having high blood cholesterol, smoking, being overweight, having high blood pressure, being a diabetic, being physically inactive, having a family history of heart disease, and then your age plays a role. 65 or older, you do have a higher incidence of death from the disease. So the CDC recommends that you manage any medical condition that you have, but learning that ABCs of heart health correlates with the A is appropriate aspirin therapy for those who need it. All of these, again, will be addressed with your healthcare provider. The B would be blood pressure control, maintaining good numbers. C is cholesterol management, whether that's managing with diet and exercise or by taking a medication prescribed by your physician. And then S is the smoking cessation, really focusing on how to quit smoking and reduce your risk. So, talk about reducing your risk. These are some things that you should be focusing on for better heart health. So, stop smoking. That's a big one. So, if you're ready to quit, you can always call the 1-800-QUIT-NOW. They have free resources, including a free quit coach, a quit plan, educational materials, a lot of resources that are available to you. We also have the Orthus Health Smoking Cessation Program, where you can work with a health coach through our smoking cessation program. There is over-the-counter nicotine gum and patches, and then there's the resource of your physician, where they can talk to you about a plan of action, whether you may need some prescription medication to help once you're ready. A second thing to do to reduce your risk is to be more active. Regular exercise is important. The American Heart Association recommends 150 minutes of moderate intense exercise each week, spreading that out typically 30 minutes, 5 days a week. Or you can even break that up into smaller chunks of time. So if you can do 10-minute increments, 3 times in one day, that's important as well. The more active you are, the better heart health you will achieve. The next is lose weight, maintain a healthy weight. 5 to 10% reduction in your overall body weight is all it takes to start to have an impact on your overall numbers for blood pressure and cholesterol. So it's important to focus on maintaining a healthy weight, or if you need to lose weight, working on weight loss and doing so in a way where you're setting healthy goals and working towards an overall goal. Next, eating better. It's important to focus on a heart-healthy diet. Think about sort of the more fresh fruits and vegetables. If you are eating grains, switching over to whole grains. If you are having dairy, moving into the fat-free or the low-fat milk and dairy products. And then just really reading food labels and choosing foods that are low in saturated fats and cholesterol. Limit your salt intake and try to reduce the added sugars, those sweets, those cakes, cookies, and candies. Knowing and improving your cholesterol numbers. And that's just basically knowing what your number is, and if you need to make improvements, then focusing on what you can do to improve those numbers. So are you going to, focus on getting more active, watching what you're eating? And that's the same for your blood sugar. If you know what your number is, you'll know if it's normal, if it's elevated, if you're in that pre-diabetic or diabetic state. It's important to focus on keeping your blood sugars in a good range, and that's something that you can achieve with diet, exercise, and then medication if need be. And again, that's something you discuss with your doctor. And then lastly, managing your blood pressure, making sure you know what your numbers are, and you may even want to invest in getting a blood pressure cuff to be able to log and check those numbers at home. And another thing to consider when you're thinking about risk is just your family history. There may be factors that could increase your risk for heart disease and stroke just based on family history, and that's something to keep in mind. Screenings for heart health, these are some of the key screening tests that are recommended, something that you'll be checking with your physician. So that would be your blood pressure. The goal, if you're not being treated for blood pressure, is to be less than 120/80. Your cholesterol panel, which includes your total cholesterol, they're looking for that number to be less than 200. Your HDL, which they consider the good cholesterol, we'd like to see that number above 40. Your LDL, which is termed the bad cholesterol, and we'd love to see that below 130. And then your triglycerides, which would be less than 150. Another screening test, something they would look at is your BMI and your waist circumference, and to see if those, if they're elevated, do put you at a higher risk for heart disease. Your fasting blood glucose, something that they'll ask you to get would be, making sure you've got a good 10 to 12 hour fast in when you have that done. And then the stress test and the EKG. The stress test is a test that, if your physician orders it, would be performed and would be looking specifically at the heart muscle in areas that aren't getting adequate perfusion, maybe related to a blockage. The EKG is a look at your heart rhythm, and it's something that only takes a few minutes to get done. So a healthy partnership is important between you and your doctor. It's a crucial step in determining your risk, and that is basically by seeing your physician and having an exam. Your doctor is an important partner in helping you set and reach goals for heart health. So knowing your numbers, knowing that cholesterol, your BMI, blood pressure, blood sugar, you have better control over your health and your heart disease risk. So work with your doctor to develop a plan to keep your heart health numbers under control. Be open and honest with your doctor to have, so that they have a clear picture of your current health and risk factors. And ask questions. Make sure you understand what your doctor is telling you about your health and wellness. Sometimes it's important, if you have questions, that you write them down before you go in. That way, once you get in there, you don't get nervous or forget, exactly what you were wanting to ask. So it's important to, maybe write those questions down ahead of time. As always, your health coach can help. If you want to focus on heart health and make healthy changes to your risk factors, reach out to your health coach today. We are here to support you. Thank you for listening to this month's webinar.